Request Rotarian Dr. Ashish Contractor to introduce our guest speaker, Dr. Rajesh Parekh.
Thank you very much, President Shanaz. It gives me great pleasure to introduce our speaker for today, Dr. Rajesh Parekh. He's someone I've known for the past 7 years and I greatly admire. So let me start with the formal introduction. Dr. Parekh is the Director of Medical Research and an honorary neuropsychiatrist at the Jaslok Hospital in Mumbai. He is also a visiting professor of neuropsychiatry at the University of Iowa and a former WHO global expert on depression. Dr. Parekh has trained in some of the finest medical institutes in the world, including the St. G.S. Medical College in Mumbai of Medicine. Dr. Parekh has been widely published, and in fact, in the last year, in I think March 2020, he released what was probably the first book on the coronavirus, and that's gone on to be a bestseller. And he's released one more book on vaccination. So I recommend all of you to definitely go ahead and read it. And that's the formal part of the introduction. Like I said, I've known Dr. Parekh for the last 7 years, and he truly defines the word polymath. He is literally a Renaissance man, and his interests are wide and deep, ranging from photography. He's got a book of photographs on Kashmir, to the music of Pink Floyd. He's a pilot. He flies airplanes. He's got great interest in history and art. You walk into his house, it's like a museum. You'll have M.F. Hussain paintings. You'll have rare Ladro pieces of Zoroastrian artifact. So he's literally a man with a very wide range and very wide interest. His knowledge on the subject is deep and wide. And I think most importantly, he's one of the finest and kindest gentlemen that I've ever met. Both he and his wife, Dr. Firoza Parekh, who herself is one of the most accomplished fertility specialists in the world, are some of the sweetest people you'll ever get to meet. From a Rotary point of view, Dr. Parekh actually addressed our club several years ago at the age of 17. He was invited then by Mr. S.P. Godrej to give a debate. And at the age of 17 was the first time he addressed our club. And I think he's addressed our club 4 times so far. And he was a member, I think, in the mid-80s or 90s. But then due to professional commitments, he couldn't continue that membership. So without further ado, I give to you one of the finest people you'll ever get to meet and one of the most knowledgeable, Dr. Rajesh Parekh.
Thank you, Ashish.
Thank you, Ashish, for that very generous introduction. I'm truly delighted to be here today. First of all, I'm amongst many friends. And even more than that, I am being introduced by not only a dear friend, but also my physician. So just a few months before the pandemic, said 4 of my 5 lobes had collapsed, pulmonary lobes had collapsed. And, that's pretty much like end stage COVID. I didn't know that because we didn't have COVID then. And then I came back to Bombay and Ashish took charge of me and he and his team made sure that I recovered in what they told me was record time. And so I'm immensely grateful to him and his team for my health today. And I'm delighted to be here with you. And, being a medical researcher, I couldn't help noticing that more than half the participants today are my friends. But what bothered me a bit is that of that half, about half joined after I left. So they were clearly waiting for me to leave before they decided that they wanted to be members of the club. But, you can't escape me. I've addressed the club on a few occasions before. And I guess you'll have to put up with me again. Now, here's the thing that I find the most challenging. It's slightly more challenging than even going up on the Alps, and that is screen sharing. And I hope I managed to get it right.
Yes, we can see the screen.
Does my screen show up?
Yeah.
All right. Thank you. So in the course of today's discussion, I'm just going to cover up some things related to Omicron, but also focus on developing resilience. Because the past 2 years have actually taxed our inner resources considerably. And many of us have developed pandemic fatigue. I hear people sounding nihilistic and saying, well, what's the point? I can't go on like this. I might as well now face the virus. So I think I'll just cover two things, an update on Omicron and some thoughts on developing resilience. And we are, okay, so I should move to the next slide. All right, quickly, just to cover, certain terms. We have all heard words like endemic, epidemic come up. So just a few basic definitions. We know what the pandemic is, but a endemic state, an endemic illness is an illness which is present in a certain population in a low grade manner. For example, like malaria or tuberculosis in our country and certain other parts of the world. And then when that illness suddenly surfaces for a short period of time in a large number, it's called an epidemic. So an endemic is like a chronic state, epidemic is acute and sudden. And when an epidemic spreads to 2 continents or more, as COVID-19 has, it is termed as a pandemic. But over the last 100 years, we have learned that most pandemics, almost all of them, in fact, have ended up again as being endemic. And that seems to be the direction in which COVID-19 is currently heading. Now, if we look at previous pandemics, we see that typically they occurred in waves. The most classic example is the one that occurred 100 years ago, known as the Spanish flu. It was an influenza pandemic. It occurred in 3 distinct waves. The second was far greater in amplitude and in severity than the first. And the third was also bigger than the first, though slightly smaller than the first. This seems to be in some ways similar to what we are experiencing currently with the third wave. And then there have been other waves. But what really stands out in the COVID-19 pandemic is that the previous waves typically lasted a year or slightly over a year. And we are 2 years into the pandemic, and there's a question mark at the end indicating that we're not even sure when it's going to end. I know most of us are now familiar about the structure of the virus, but there's a reason I'm covering it, because we'll now come to Omicron. And what is the virus? Basically, the virus is an entity which just wants to reproduce. There is a DNA material inside, or RNA, as in the case of this virus. And then it is surrounded by a membrane, which is a lipid membrane. It means it is an oily substance. Now, this explains why detergents work, because they dissolve oil. I mean, if we have oil on our hands and we try to wash it off with water, we're not as successful as we are with soap, which manages to neutralize it. So the coronavirus has a lipid coating. It has the RNA inside. And again, we're very familiar with the terms now, the spike protein. This acts like a key which enables this virus to get easy entry into human cells, because our cells have ACE2 receptors, which you can see at the bottom. And these receptors are like locks, and the S protein of the coronavirus fits into it almost perfectly so as to enter the cell. And then once it's in, all it wants to do is reproduce. So it kind of hijacks that part of the cell which is involved in reproduction. Think of someone who enters an office, is not interested in anything else but the photocopying machine, and just hijacks that machine and keeps making copies of itself. So that's what the virus does. When the cell gets filled with the virus, the cell wall bursts and it goes on to infect other cells. And here is why the Omicron variant is more infective than previous variants of the coronavirus. It has numerous mutations on the spike protein, which make it more efficient in entering the cell. So that's the one thing that distinguishes Omicron, that it gets far easier entry and faster entry into our cells because of the number of mutations on the spike protein, which you may recollect is like a key that unlocks our cells' defenses. And these are the characteristics of the Omicron variant. 36 mutations, high transmissibility, high infectivity, reduced lethality. So about a month ago, there was a very interesting study which was conducted by Cambridge, United Kingdom, and the collaborators were from Delhi, Hong Kong, Japan, South Africa, and it was a laboratory study in which they took vaccine-induced antibodies from the blood of people who had received vaccines earlier, the mRNA platform vaccine, and then adenovirus-based vaccine. And when they took these antibodies in test tubes, they found that the Omicron variant was able to elude these antibodies. It could dodge them. And that explains its high infectivity. But in another arm of the study, they took lung cells, again in the laboratory, and they found that it does not penetrate the lung cells. Hence, the predominant symptoms are sore throat. It doesn't descend into the lungs and disable them. And hence, the lethality is reduced. We've seen that it eludes vaccine-induced immunity, and its infection rate is high. But again, something of concern, in the United States, due to Omicron predominantly, there's been a 50% increase in pediatric admissions. And, for those who are vaccine skeptics, here is the data. These are the rates of vaccinated versus unvaccinated people in hospitalization in the United States. Close again, another study showing that out of 430 people who are hospitalized in one series of hospitals in the US and South Carolina, only 29 were vaccinated. Of the people in the ICU, of 107 in the ICU, only 7 were fully vaccinated. And then when you look at people on ventilators, the difference is even more stark. And in Mumbai, in our own city, the municipal commission about 2 weeks ago released this data. You may be familiar with it, that of patients who required oxygen in hospitals, 96% of them were unvaccinated. Moreover, when we look at the mortality data of the past 11 months, so this is 4,575 deaths, 94% of COVID-19 deaths in Mumbai were amongst the unvaccinated. If I was in a court of law, I would say I rest my case. So what can we do to stay safe? The most important thing, while there can be debate about the relative efficacy of different vaccines, what is unequivocally clear is the simple methods of COVID-appropriate behavior, masking up, physical distance, hand hygiene. These work almost 100%. So they're very, very simple measures. And I think we should count our blessings and be grateful that these simple measures are so effective. And of course, exercise, nutrition, sleep, enhance immunity in study after study going back to almost 50 years. It's very important for us not to get consumed by misinformation and certainly not to spread it. In fact, within 2 months of the pandemic's onset, the WHO declared a parallel infodemic, a widespread dissemination of fake information. And the WHO warned that this infodemic was almost as dangerous as the pandemic itself. It is important for us to dispel vaccine hesitancy. Some time ago, I was on prime time and a thought just occurred to me. And I described people, perhaps a bit harshly, I described people who refused to get vaccinated, refused to wear masks as bioterrorists. And I made the analogy that just as a terrorist sprays AK-47 bullets around, a bioterrorist endangers not only himself, but people around by spraying viruses, which can sometimes be just as lethal as bullets. When I said it, for a moment, I wondered whether I was being extreme, but then, extreme times such as today call for extreme words. I mean, think of the millions who have died across the world. Think of what's happening in all our lives. And, few people who are vaccine deniers and even COVID deniers are endangering themselves, their immediate families, and all of us. And clearly now data from all over the world indicates that boosters help. In fact, for 5 weeks, I was working on a relentless campaign, putting in almost 3-4 hours a day at various levels, bureaucrats at the center, at the state, at the city, and of course the media to get boosters through. So some of us, and I certainly, were delighted that boosters were available. We hope they're available in a more widespread manner. In terms of which booster, well, that's pretty much taken care of. We have just 2 boosters in our country. So whichever one that's available is the one we take. The data is all there. Clearly, taking any booster is better than not taking any booster at all. And now we move on to what are the stresses we need to deal with on our day-to-day basis. So there are new variants and mutations. We don't know what's going to happen next. Of course, the infodemic in its own right is getting us fatigued, and so is the pandemic. And, I think a substantial portion of Rotarians, particularly in this club, are well versed in economics. I kind of saw Nandan Maluste somewhere there. Again, an old friend of mine who just waited until I left to join the Rotary Club. So we know what is happening, and not just at the level of people who are running businesses, but also workers, migrant workers, particularly during the previous waves. And of course, many of us are struggling to balance home and work. And some of us, unfortunately, have to deal with grief and loss as well. Social isolation, even outside of the pandemic, in several studies, has been linked to heart disease, diabetes, psychiatric disorders. It increases the risk of early death by 26%. And social isolation, mind you, costs $6.7 billion annually in the United States alone. When work from home started, I'm sure a lot of us were thrilled. You didn't have to negotiate traffic. It seemed easy. But although over 50% have moved to work from home, the latest data indicates that 57% of people dislike it. And astonishingly, 75% of people working from home are experiencing burnout. Now, this is understandable because as the lines between our personal and professional lives get increasingly blurred, people are working harder than ever before. And so although I was surprised in the beginning, when I looked at the study, and all the studies are there in fine print below, so that I'm able to persuade you that I didn't make up all this. But it's a large number of people experiencing burnout. This has resulted in an impact on job satisfaction, job motivation, and even company satisfaction. Moreover, 44% of people have personally reported a decline in their mental health while working from home. Here is the psychological impact across the world of COVID-19. These are studies, one study done in 78 countries. It's showing substantial numbers of people experiencing stress, depression. In China, we can see anxiety, depression, post-traumatic stress disorder. And the numbers don't the numbers go beyond 100 because there's a considerable overlap. So people with anxiety also have depression very often. Let us look at our own country. So studies done in our country again show varying but substantial numbers of people experiencing psychological distress. Almost half the population reporting symptoms of depression and or anxiety. And when they did a study among 18 countries, I think this was coordinated by Nimans and Bangalore, during the second wave, India had the highest levels of anxiety amongst 18 countries, and 80% of people have expressed the need for some kind of professional help from mental health experts. Perhaps the silver lining on this is that seeking mental health is becoming increasingly destigmatized. When so many people are experiencing distress and talking about it openly, the ones who are going through severe psychiatric disorders are at least more open about seeking help. And the last part of this presentation, I'm going to talk about resilience. How do we ride the pandemic's waves? Now look at surfers. When they see big waves, they are thrilled because they have trained themselves in the art of negotiating these waves. And we too, by building resilience, can enable ourselves to ride the pandemic wave. I am, was that a message for me from someone that I should be winding up? I'm not sure. I overheard something, but I don't know what it was.
No, it's fine. Please, doctor, please continue.
How many minutes do I have so that we have reasonable time for question answers?
Well, we normally go to question answers. We normally wind up at 2:30, but we can do another 5-10 minutes more because there'll be a lot of questions.
Okay, actually, it's 2:20. So I am going to finish well inside of 2:30 for sure. Okay. All right. So when it comes to coping, there are different strategies that one can develop. I just jumped the previous slide, so let me just cover this. There are different strategies. These are emotional, cognitive, where we apply our thoughts, and behavioral. In terms of the coping strategies, the most important thing is to ask ourselves, are we responding or are we reacting to a situation? When something bothers us, when something goes wrong, the first impulse is to react. And often the reaction is purely emotional. It's not cerebral. It seems to have bypassed our processes, our rational processes. And we often, regret. And sometimes reacting actually escalates the problem. Responding is stepping back a little, understanding what has happened, understanding what the other person is going through. And then it's a more calibrated, a more measured response to the situation. This is something we can train ourselves in. Then breathing and relaxation exercises have time and again, in a slew of studies, shown that they help in dealing with stress. Well, we're all aware that when we are stressed, our breathing pattern changes. It becomes shallower, it becomes faster. What many of us are not aware is that the relationship is reciprocal. In other words, by controlling our breathing, we can also control our stress. And that is the basis of yoga, meditation, mindfulness. And I can aver to that. I have been practicing yoga now for a little over 8 years. Firoza, my wife, persuaded me to get started on yoga. I make 15 minutes of time every day. That's easy. And lately, I've also been practicing mindfulness, which is, being in the here and now. And that has helped me personally in a big way. And I've been recommending it to whoever consults me. And by and large, people have attested to the importance of yoga, mindfulness, and meditation in dealing with stress. And then there are distraction strategies. Quite clearly, these don't work in the long term. But sometimes when we are faced with stress, if we distract ourselves, music, book, looking at something else, it gives us time for a measured response so that we do not react, but move away a bit from the problem and then approach it again with a renewed rational approach. And then there are the cognitive strategies. It's important for us to know that knowledge is power. A lot of the angst that is associated with this pandemic is from incorrect information. And I'm sure all of us experience this every morning. You get all kinds of conflicting views, and some of them are, completely wrong. And if we are armed with the right knowledge, that's like a shield. That's like an extra layer of protection, which strengthens us to deal with the infodemic. And, when we first wrote our book on the pandemic, that was in January 2020, before we had a single case in India. In that book, just slightly over 2 years ago, we emphasized the difference between physical and social distancing. The correct term, we believe, should be physical distancing, because while we are physically away from each other, we can be socially connected. And I think, look at the amazing job you Rotarians are doing. We're all connected with each other. I'm chatting with you today. And the technology, fortunately, has enabled this. So it's important for us to remain socially connected. Again, several studies, and including one which was going on at Harvard for more than 50 years, have shown a very robust link between social connectivity and longevity and good health. Then empathy, the ability to put ourselves in other people's shoes, to experience the world through their eyes. is a good cognitive strategy, because the corollary to that is we realize that there are people who are far worse off than us, that we actually are very fortunate in our positions. And instead of feeling sorry for ourselves, we become concerned about other people's concerns. And I think, Rumi's excellent tribute to Rahim Uljiani, who I knew as a colleague at Jaslok, and I'd been to that Taloba Center a couple of times. Those early morning drives were pleasurable in themselves. Just indicates that, caring for others beyond our needs is a good strategy for us to deal with stress in our own life. And then it's important to talk about it, because when we discuss our issues with others, they do that too, and we understand other people's concerns. We are able to do a reality check on our thoughts. Do they stem from facts, or do they stem from personal beliefs, which can sometimes take on the proportion of delusion? And most important, in chatting with friends, I've also discovered in my own life that we focus on the solution rather than the problem. Sometimes, in a crisis, we get warped in a loop of self-pity. Why did this happen to me? Why am I going through it? And we are not focused on the solution. Talking to our friends helps us to get that focus on the solution rather than the problem. And finally, the behavioral strategies. These include staying connected with everybody. I've talked about that earlier, and we should never forget the importance of self-care. The pandemic has provided us with the luxury of having some time at least to look after ourselves, and exercise, sleep, nutrition boost our immunity, they improve our health. And I cannot adequately emphasize the importance of self-care as an important behavioral strategy in coping with the uncertainty of the pandemic. And then it's a good idea to have a proper routine. And, we talked about knowledge being power, but, just being obsessed with it can also increase our stress rather than diminish it. And I must confess that in the first 2 months of the pandemic, I was looking at the data from all over. I had spoken in the directors meeting at Jaslok on the 4th of February, 2020, warned of what would happen. And I was just checking regularly. And then it came to a point where I felt that I had to reduce this to just twice a day rather than 20 times a day. And so it's important for us to have some restriction on news time so that we're able to give time to exercise, sleep, nutrition, and staying socially connected. And then again, altruism. The Eye Center is an absolutely near perfect example of altruism, getting involved in the problems of others. And that is one of the tenets of the Rotary movement, does help us to look away from our own stressors, appreciate what other people are going through, feel grateful for what we have, and share it with others. And then, the pandemic has provided time to do so many other things which we put away, time with our family. I used to have piles of books waiting to be read. I'm now able to negotiate my way through them. And whether it's television, movies, music, new skills, hobbies, and even webinars like this, which I hope are not stressful, we can do all of that. And of course, if the symptoms persist, we should not hesitate to seek professional help. Let me come to some examples of people who have in the past mastered coping with previous pandemics. Now, the plague pandemic of about 500 years ago was far more devastating in scale than anything we're seeing today. A quarter of Europe's population was wiped out. The remaining 3/4 was covering in fear. All kinds of things were happening during that time. I mean, one could do a 1-hour talk just on that. But during that, there are people who use that time to come up with some extraordinary, and I'm giving you just 2 examples, Shakespeare and Newton. Shakespeare wrote 3 of his most powerful plays during that time, Macbeth, King Lear, Antony and Cleopatra. And, for those of us who love Shakespeare, and I consider myself to be one of them, there are actually traces of the pandemic running through these 3 plays. Newton came up with ideas which changed our world and continue to impact us even today. Gravity, calculus, optics, the laws of motion. So here are people who used the time provided by the pandemic to do things which are important. And, I too, in my own small way, have been able to harness the time provided by the pandemic to do things that I had already put away. As Ashish mentioned, the book that was published by Penguin Random House become a national bestseller. It's being translated in 25 languages. I wrote another book on vaccines, which has also become a bestseller. And there have been other books which are coming out now, 3 in various stages of completion. But most important, for a long time, I had this idea, a nascent idea, that teaching mental health into the school curriculum, the way we teach physical education, if we were to teach mental health, it would help diminish the increasing rates of anxiety, depression, and even suicide amongst our school children. And along with my brilliant colleagues, Munira Kapadia, Mahira Desai, who are psychologists, and whose help I must also acknowledge in getting this presentation ready, we were able to put together a whole primary school curriculum, which is now currently being evaluated, and make our contribution to helping in the mental health of our students. And finally, what are the lessons of COVID-19 that we can draw upon for the rest of our lives? Most important, we are only as safe as the weakest amongst us. Omicron has taken off because of low vaccination rates in Africa to begin with. And as long as some of us are unsafe, all of us are unsafe. Then let us not forget the hunger crisis. We're all talking about disease, ICU beds, oxidation, but there is the collateral damage of this pandemic. 300 million from acute hunger, many will die. We know about the migrant worker crisis, one of the most catastrophic stories in the history of our country since partition. I think we've also learned that politics, power, money cannot save us from a pandemic. But science can, research can, and frontline workers, their willingness to put their lives on line can. And, there have been over 180,000 healthcare worker deaths in 2020 alone, over 500,000, and now the numbers must have escalated in Omicron. Healthcare workers have been infected. And we need good science, good technology to help us get through. The role of technology, I used to be a technophobe. I didn't own a cell phone until 6 months before the pandemic. My children persuaded me to get a cell phone, telling me that it's like a computer in your pocket. And, it has been such a boon in the pandemic. And finally, the pandemic has allowed us to ask ourselves, what is really essential in our lives? We hear the word essential services all the time, but what is truly essential? Is it the titles we hold? Is the stocks that we have hidden away somewhere? Is it power? Or is it the ability to connect with those who matter to us, our family, our friends? Is peace and love an important priority? And so the pandemic has allowed us to reprioritize our lives. And my final message, this is my last slide, would be that some good can come out of this pandemic. I hope we emerge from it as a stronger species, that I'm sure. But I also fervently hope that we emerge wiser at the collective as well as at the individual level. It's been a pleasure to talk to you. I look forward to discussion.
Thank you. There are probably a lot of questions that are going to come up, and we have really run out of time. So we'll run through the questions very quickly. I had one question. What is your take on natural versus, whether this whole thing has been engineered?
Oh,
that's
okay, you have to buy my book. Should I tell you now, or will you wait till my new book comes out?
Okay.
All right. I do a little teaser. Okay, I'll tell you something interesting. We had a debate on our foundation day at Jaslok. We had a debate in which we talked about the engineered versus the natural. I am a believer that this is not natural. I looked at all the data. I spoke in the debate. I had the director of infectious diseases at Jaslok, who spoke on the other side, saying it was natural. And I knew I was onto something when he phoned me 2 days before the debate and said, would you like to switch sides? So I
My
said,
God, this is an amazing declaration. Amazing. We have to read your book.
yes, but you know what I'm going to do? I'm going to, Ashish, if you'll do me a favor, I'm going to just send a bit of that debate to you and you could forward it, because in that I put
Sure.
together all the arguments for a man-made virus.
Thank
Sure.
you. Thank you. I think Mayank Kumar has a question. Mayank, quickly. Anybody else has a question?
Doctor, just going to the thing on boosters where you said we have to take what we are permitted, but suppose we had a choice between the various vaccines available in India, would you advise somebody to mix rather than take the same?
Yeah, Mayank, it's not just my advice. Data indicates that. So what you call the hybrid booster. So if you've taken 2 doses of one vaccine and then you take the booster from another, that confers a higher level of immunity than just taking the third one from the same vaccine. But you know, there is a logistic issue in that, and that is 90% of our country has been vaccinated with Covishield, about 89% maybe, and 10 to 11% has been vaccinated with Covaxin. So all the people who got Covaxin could probably get a Covishield booster, but it's not going to work the other way around. But as solace, data also indicates that taking any booster is better, much, much better. The incremental benefit from taking any booster is higher than the incremental benefit you get from taking a hybrid booster.
Thank you.
Thank you.
So if there are no more questions, then I would like to ask Fali to give us a vote of thanks. Any more questions? I thought there would be a lot of questions on this, but I think, Doctor, there doesn't seem to be too many questions. You seem to have covered everything satisfactorily.
That's a polite way of putting it, but I'll accept that.
Sorry, Shirley, can I ask one question?
Of course, please, Nandan, go ahead.
Rajesh, what about this question about the natural immunity from having had Delta or Omicron or whatever? Is that as good as a booster?
To a notional extent. Almost everybody has had some kind of natural immunity by now, at least in our country. And I don't think it's a substitute for a booster. So, you know, herd immunity. And I guess we don't have enough time to get into that. But let me just give you an example which will make it clear. The countries which use the herd immunity approach, the natural immunity approach, realized it was a disaster. 2 countries come to mind, Sweden and the United Kingdom. Boris Johnson famously talked of herd immunity in the beginning, and then he fell ill and hovered between life and death for, I think, 3 or maybe 4 days in an ICU. That was the last time he talked about it. So yes, at a mathematical level, there is a certain precision in thinking of herd immunity. Basically, it's culling the herd. You know, it's if I were to summarize it, let a lot of people die. The fittest in a Darwinian sense will survive and stay well. But you know, the hybrid immunity that comes from natural infection and from vaccines and boosters is clearly the best immunity. So we shouldn't rely only on natural immunity.
Thank you, Dr. Parekh. I think I'm left with the pleasurable task of talking of a vote of thanks to you as a token of our appreciation for the afternoon spent with the members of our club. We will, on your behalf, plant 10 fruit-bearing trees at the Nilmati Dandawal Gram Panchayat in Maharashtra.